What is the state of the rehab industry currently? Where does this stand as a result of COVID, as a result of changing situations in general, as mental health changes, as drugs are more prevalent? What is the state right now of this industry?
So it's really, the rehab, and I use the term rehab and treatment facility and addiction facility and mental health counseling, outpatient, sort of interchangeably for this conversation. But it's really in its infancy stages. It doesn't know what it wants to be when it grows up. There's a lot of eyes on it right now, more so than it's ever been in my career. It was kind of a non-entity, kind of a stealth, under the radar type of industry for many, many years. And then over the last decade, people with money, investors, private equity, started to pay attention to it, and it's really blown up in the public conscience. The problem that I have with the state of rehabs right now is that it's not regulated. One of the saddest things that I know I deal with as an owner and a CEO and a leader in the field is anybody can be a rehab owner. You don't need a degree. You don't need experience. Anybody off the street can be a rehab owner.
You just have to acquire a license. That's it.
You read my book. I mean, that helped you, but before that, you could have been a rehab owner. You have to obtain certain state licenses, and there's not a lot of scrutiny, when it comes to that. The system is not structured the way that it can be, or that it should be, and I think ultimately that it will be.
Why do you think it's so unregulated?
Well, I think that it's basically it's partly because it's new, and it really hasn't made a lot of noise. People sort of left it alone, but now it's gained a lot of popularity, a lot of publicity. Public conscience is looking at things like patient brokering and kickbacks and illegal activity, and so they're not okay with that. Patients are being treated like slaves in an industry that you're supposed to be taking care of people, and it's not supposed to be just about money.
Can you explain what patient brokering is to someone who would have no idea what that means?
Sure. So patient brokering is when an entity, it could be a company, could be an individual, and they want to send you, or you want to obtain patients, and they're able to get patients for you, and you pay them. You pay them either per patient, or you pay them a lump sum. A lot of times it's done off the record. It's done in cash. A lot of times it's set up as a case management service or a call center. Where people are paying thousands, hundreds of thousands of dollars to get patients in, instead of doing it the right way by promoting your company, whether that's on social media or B2B marketing or handshaking and kissing babies and all that other stuff. This is a form of manipulation. Go ahead.
Where is the pool that they're even getting these people from? You're saying that doctors that may be seeing people are saying, hey, I think you should go here to deal with what you're dealing with, and kind of pushes them in that direction. Like, where are they finding these patients to even broker?
So they find them anywhere that they can. A lot of them are, younger folks that don't have insurance, that really don't have a clue about the way things work, and they incentivize these people to go to treatment. hey, if you go to treatment, I'll pay you $500 or $1,000 to go to treatment. And then while you're in treatment, if you write a blog for me, or if you promote me on social media, then I'll discount your bill by 10%. They've even hired family members to go and to literally harpoon other patients out of treatment centers. Hey, if you go to this treatment center, get admitted, and then pull out 3 patients and come to my treatment center, I'll give you a bunch of perks.
So this is ruthless.
I'll pay you. I'll hire a prostitute for you. I'll do all these things. A lot of them get the guys high, so they get them high to do their bidding for them.
Imagine that.
Imagine that. So they're really exploited. There's really a lot of victims here. The victims are it's the patients, right? Because a lot of them are dying because of this activity. B is the families, because the families aren't getting any help and they don't know what the difference is. Somebody could say whatever they want on the internet. That's where I go back to. There's no regulation, right? So there's not. Insurance companies can't stand, especially the substance abuse side of rehab, because everybody lies to them. They don't know if a claim is really clean or not.
Right.
And it's just a burden on the system. What I think is going to happen is, I think over the next decade, most of the treatment centers that we know to be rehabs are going to go away. I think that insurance companies are going to force people to go in network. I think that the bigger treatment centers will survive. My hope is that through this, that there's a regulation and that there's sort of a structure to it, that whatever the level of care is equals a certain amount of money. Doesn't matter what level of care it is, inpatient, outpatient, intensive outpatient, psychiatric facility, but there's a number assigned to it, a financial number, and that's what you get across the board.
Right.
And this way, a lot of the way that the financials are set up within treatment centers, that could be minimized, and a lot of the way that marketing is done, the illegal or unethical activities, can be minimized. I don't think it's ever going to go away, because I think in every industry you always have, these kinds of things that go on. But it's an interesting time because it's really in its infancy stages. The good news is that we've got a lot of smart people. We've got a lot of breakthroughs in mental health. The fact is, finally, addiction is getting its due, in that it's a mental health issue. It's not a drug issue, and then you have mental illness. It's all under the umbrella of behavioral health. So addiction, drug addiction, alcoholism, all of that is under the umbrella of mental illness. It stems from trauma, which has its foundation in anxiety, and if you chisel it down even further, it has to do with obsessive compulsive thinking. So you have a combination of obsessive compulsive thinking with trauma-related issues, and you have the makings of an addiction, you have the makings of mental illness, and it should be treated as such. This separation of, addicts to the left and the mentally ill to the right, it needs to stop. It needs to stop. Yes, you have schizophrenics that need primary mental health, but this thought process of they're separated it's just not conducive to treatment.
Yep, that makes sense. And I've noticed that even in previous talks that you've talked about that this is a dual situation. I think
it is.
You know what I mean, and it needs to be treated that way, but all falling under one umbrella, because the treatment itself is there to take care of both ends of that, and they seem, like you said, they kind of work hand in hand. They wrap around each other.
Right, and they really do. And then if I took it a step further, gender-specific treatment works, age-specific treatment works. Then if you even get into the psychiatric part of it, that's when you start to sort of separate some people within the context of treating both or however many ailments a person might have.
Right. No, it makes sense.